las riendas.
Podemos sentirnos
Un equilibrio entre la mujer y el hombre, ¿no? Conversation. I want this episode to be very focused on prevention from a very young age. Mm-hmm. So I've seen that you talk a lot about pregnancy and how you can prevent it by already having good habits 2 years before. Yeah. But also very, very special for patients or whoever listens to see how important and what an impact it has the first few years of life.
Okay, so not pregnancy and before, but especially from birth and thereon.
Yes, because I've seen, from what I see in your practice, which you are more than welcome to talk about it, your practice and how you work, is you focus a lot on prevention and breathing, right? Yeah. It's called Respire for a reason.
I explain it to patients that in the order of things we need to survive, breathing is pretty high. Yeah, but I say it that way because then they realize, well, yes, actually it is pretty high, and I say that's why the practice is called Respire. And I said, and we can see what is happening there through the mirror of the mouth. That is a little bit. So it's not that I'm everything goes around breathing, but it all starts from there. So
right, okay.
It's not that I send every patient for breathing therapy, but it's the link that connects everything together.
Okay.
So because it's still, I personally still feel that working on your breathing is the most difficult thing to do. Myofunctional therapy is, if you're motivated, it's easy. You just do it and it happens. But with breathing, you have to do it and you have to focus and you have to accept that it's not immediately going to get better and some days it will be worse. And so I think it's one of the most complicated things. So one, there's not a lot of people who are good at teaching breathing. I don't believe that every breathing method is right. I still think there's a lot of people talking about 4 breaths in and 6 breaths out, and 1 in through the nose and out through the mouth, or do a big sigh. And I hear patients saying like, yeah, I've been to breathing therapy, and then I had to breathe in through my nose for 6 seconds and breathe out through my mouth for 4 seconds, and then my mind already shuts down. And like, yeah, you did not have breathing therapy. You just, I don't know what they did, but it's not breathing therapy.
Fair enough. What do you mean by breathing therapy?
It might sound a little bit dogmatic, but to me, the only breathing, it's not a way of breathing. I think the only method that comes close to physiological breathing is a Buteyko breathing method.
Okay, amazing that you bring it up.
It's the only one to me that makes sense. And that also has a very good explanation from a medical point of view and a physiological and an anatomical point of view. It just makes sense to me.
Yes, okay. It doesn't make sense to many people because I hear Buteyko, but teaching it is quite complicated.
It is. And that's why we're nowhere near the healthy population that we should have, is because our breathing is so bad, and that's why it's so hard. I read a book on meditation, and basically any type of breathing method that you do is meditation. And I never want to meditate because I'm very bad at it. And the guy says, the reason you should meditate is because you are very bad at it. Yes, and it is the same with breathing. We are all very bad at breathing, and it is exactly why we should do it. And it's exactly why it is very hard to work on your breathing. But in a perfect world, everybody would at least try. And if we would get a little bit better at breathing, that would change a whole lot more.
I agree. And for the people who don't know what good or bad breathing is, what is a bad breathing?
Can I say what good breathing is?
Yes.
That makes more sense to me. Yeah. Good breathing is always through the nose, and good breathing is not deep breathing from a visible point of view, because a lot of people think deep breaths in, deep breaths out. No, deep breathing is actually very shallow breathing, but shallow breathing brings more oxygen to your tissues. And we know this because, I don't know, in Belgium, we're very fond of cycling.
Yes,
And
I am aware.
we live by it. And what do we do with the guys that we want to get better? We have them go do their workouts in the mountains. Why? Because there's less oxygen there.
Okay.
So we know that we don't need more oxygen. They know that we need less oxygen. It's not only for cyclists, it's for everyday, regular people. We need to breathe less so that our body starts to function more efficiently. Okay. So when you're breathing, let's say from an external point of view, yes, you're breathing shallow. From an internal point of view, you're breathing deep.
All right.
Does that make sense?
Yes, more or less, yeah. But it's completely a different way that I had understood it.
Yeah.
I thought breathing was like for always through the nose, but more deep to activate the parasympathetic system.
I'm pretty sure that like the Wim Hof method, for example,
yes,
as well,
yes.
And those methods, I'm pretty sure they all have their advantages when you use them, when you breathe right.
Okay.
But the thing with breathing, as with meditation, and that's why the Buteyko method is the only one to me that makes sense, is you cannot control it. Once you try to control it, you're not meditating anymore.
Yes.
The idea of meditating is letting it flow. And if you're counting your breaths, then you're trying to control it. And you should just try to relax. Relaxation is the basis of good breathing. So, as I said, it's always through the nose. It is from an external point of view shallow, which means you don't see it, you don't hear it. And it's actually, and that's the difference between the classic Buteyko technique and the more Western Buteyko technique. The classic Buteyko technique actually makes you breathe in and out really fast.
So, can you show us?
I will exaggerate. I will make it more clear, but
okay.
But then very small, so it would look like this.
Right.
So you don't see it. And that's because if you look at the graphic of it, if you're breathing in slowly and breathing out slowly, or if you're doing this in and out fast, and you look at the surface underneath the curve, you are breathing in much more air when you're doing this, and you're breathing out much more air. When you're doing this, the amount of air that you're moving around is very small.
Okay.
And then your body starts to use that air and that oxygen that comes from it very efficiently. So it's smaller breathing, and we know this because the professional athletes that live the longest are apnea divers and swimmers. And why swimmers? Because their breathing is being restricted the whole time. And yes, swimmers breathe through their mouth, but it's very restricted. Who are the people who have the best breathing technique? Are people who play, how do you call it, like the flute and the trumpet. We call it blowing instruments, but yes. I don't know if that is the term. That might sound completely wrong. Sorry about that.
It's okay.
But because they have a counterforce on their exhale. Because it's not about what you breathe in, it's about what you breathe out.
Oh, really?
So, as I said, it's the amount of air, it's the relaxation that's important, but it's mostly about not breathing out too much. Because when you breathe out CO2. And CO2 has an extremely bad reputation, but it is actually more important than oxygen. If we don't have CO2, we don't live. And we know this because in our basic training, we learned that our blood cells, our red blood cells, bind to oxygen. And the only way to release the oxygen is when CO2 comes in its place. It's called the Bohr effect, B-O-H-R. And there's one molecule that has a better affinity, and that's CO. That's why people get intoxications during the winter when there is not good ventilation in their houses. This is a problem in Belgium with old heating systems. I don't know if you have this problem here.
I've not heard of it. But...
So they have these types of heating that produce a lot of CO. So the house fills up with CO. The person breathes in CO. It attaches to the red blood cell, and oxygen cannot bind to it anymore, and they die. So it's a very big issue in old houses with old heating systems. But so we know that CO2 needs to bind to the red blood cells so the oxygen can let go. And the oxygen needs to let go because it has to go to your brain, it has to go to your muscles, it has to go to your baby when you're pregnant. And people are like, yeah, I have 99% oxygen in my blood. What does that mean? That means that 99% of your red blood cells have oxygen, which is amazing. But you will die if the oxygen stays in your blood. It has to go out. And that's why we need CO2. So when we're breathing in a lot, we're breathing out a lot. We're breathing out a lot of CO2. Our arterial CO2 level goes down, and the oxygen doesn't go to the tissues as much as it should. When someone is hyperventilating, we do either two things. We let them blow into a bag.
Yeah.
Why?
To increase CO2, no?
To increase CO2. Or in the movies, you slap them in the face. Why? Because they stop breathing, because they're scared. Their muscles and their tissues are still working, so they produce CO2. CO2 levels go up, and the brain gets oxygen again.
Wow.
It's why people, when they hyperventilate, they faint in the end, because there's no oxygen going to the brain, because they're exhaling all that CO2, and that wonderful oxygen is in your blood, and they still have 99% oxygen in their blood, but it's not going to your brain.
Okay.
So the brain is like, okay, please stop breathing, because I need that CO2 to go up again. And that's what I think sleep apnea is too. It's when your brain says, you're breathing out way too much CO2, and if you stop breathing, the CO2 will go up again, and you will get oxygenated again. But there is a problem that when you're sleeping, if the CO2 level rises too much, you wake up.
Yeah.
So it's a bit the system that's trying to correct itself, but it has, the balance goes too much from one side to the other. So the body's like, okay, you're breathing too much. I'm going to make you stop breathing. Oh no, now you stopped breathing for too long. I'm going to wake you up again. So all these problems always come from breathing too much. And we learn like, yeah, if you're stressed, just let out a big sigh. No,
it's the complete opposite.
It's the complete opposite, yeah.
Very interesting. I wonder why then holding your breath for anxiety, a lot of people recommend it, right? But I was trying to decipher what you were saying. By shallow, you don't mean hyperventilate.
No,
sometimes
definitely not.
Shallow breathing, you understand like
that's why I try to make the difference between external shallow breathing, so it looks as if you're almost not breathing. In a baby that's breathing right, the mother, I had it a few times. I looked at him while he was breathing, at my son, and I looked at him and like, is he actually breathing? You shouldn't hear or you shouldn't see a baby breathing. And if you observe closely, and you observe this in a lot of animals too, you see their belly going like this. They breathe really fast. Animals do too. And for some reason, we've learned that we need to breathe slow. But like I said, then you're breathing in more and you're breathing out more when you're breathing slowly. So it looks as if you're breathing shallowly, but internally, you're getting a lot of more oxygen to your tissues.
Right.
So that's why, to me, the Buteyko technique, I don't like the word technique because I think it's the physiological way of breathing, makes much more sense to me than any other one.
What you were representing before, it sounded like the fire breathing in yoga or pranayama.
Yes, but that is forceful.
Okay. It's not the same effect as a normal
and that's
breathing.
what I was saying. I think that all these breathing techniques do have an impact on your nervous system, but not on a person who is chronically hyperventilating. What all these things are doing, what ice baths are doing, what fire breathing is doing, what Wim Hof technique is doing, is hormetic pressure.
Yes.
Putting hormetic pressure, but in today's society, hormetic pressure makes no sense because people are constantly under pressure. from a mental, but also from a physical point of view. So if you're asking a patient who is tired, who is burnt out, and you're saying, go have an ice bath, you will feel better, it might help for a little while. Why? Because it's going to get out all the last adrenaline that they have, and that might make them feel better. But it's not helping them because they're under pressure all the time, and they don't even feel that hormetic pressure anymore at some point. And it's the same with breathing. Most people are over breathing all the time.
Yes.
So then giving them the Wim Hof method to overbreathe for a little while is not going to make them better in the long run. Right. And a lot of these things make people feel better for a little while in the short run, but you don't know what it's doing in the long run.
I'm guessing it has to be guided and with a lot of different instruments. Like you can do the Wim Hof, but then you have to change your diet. You
would for hormetic pressure. I think I'm definitely not an expert, but I want things to make sense. Hormetic pressure works really well when you are not under constant pressure. If it would be like saying to someone who's working 24/7, I'm going to make you work a little bit more hard. It's going to make you better. No, that's not going to help. Someone who's working 5 hours a day and you say, I'm going to make you work a few more hours today, you're going to feel good. Yeah, he's going to be like, oh, at the end of the day, I worked a lot today. But that's not going to be the same effect on the person who's been working 24/7 for the last few years. I think it's a little bit that way that you should look at it.
I understand. And the Buteyko method or the Buteyko breathing that you're saying, is that something you have to take in to be like your breathing, daily breathing?
Yeah. Okay. And that's the difference. It's to me the only technique that talks about how should you breathe every single day. And then there are exercises that you can do to improve your breathing, but they are not the daily breathing.
Of course.
They are separate things to get to the goal of having a good shallow, let's call it that, a good way of shallow breathing during the whole day. My biggest problem still is when I talk, I breathe in too much. So what we do, and it's already getting better, we talk, we empty our lungs, and then we go, and we go again. While when you're talking in a restful way and in a positive way, you would be taking in small little breaths through your nose in between breaks. So a simple exercise is to read, and whenever there's a point or a comma, you close your mouth and you breathe into your nose. And then you can learn to breathe while you're talking.
Okay.
I'm still working on that.
Similar to when you're chewing. I know a lot of people that chew without breathing, swallow breathing. No, I mean without breathing, no. Taking in a lot of air and then they bloat. Yeah. That's also an issue.
Exactly.
All right. And where do we learn how to breathe? Like what point in our lives do we start breathing? I think that takes us to...
as soon as we're born. As soon as they cut the umbilical cord. That's also why I wasn't worried when my son was born with the umbilical cord around his neck, because he's not breathing through his by himself. But then, as long as the umbilical cord is still pumping, he's getting all the oxygen he needs through there. So that's already one myth that we can get out of the world this way.
Very good, thank you.
Because 1 in 3 babies is born with the umbilical cord around their neck. It's a completely normal thing. But as soon as you cut the umbilical cord, then they're on their own. Yeah. So the first thing I would do, I would say, to improve your breathing is to delay cutting the umbilical cord.
By how much? I've never heard this.
I would say at least until it's gone completely white. As long as it's blue, there's blood coming out, because I think about 1/3 of the blood of the baby is still in the placenta. So you want that blood with that oxygen to be in the baby before you cut it.
Okay.
So with me, I think we cut it at about 3 hours. And then you can do the full lotus birth, where you keep the placenta and the baby attached until it falls off by itself, but I didn't do that. So that would be the first thing, because you want the baby to get in all that oxygen and all those nutrients from the placenta before he starts breathing on his own. He will start breathing, obviously, before you cut the placenta, but it's that little extra nudge that they need. Yeah.
Wow, this
So
is
that
so
would be my
enlightening.
first. Yeah,
I'm not a mom yet, so maybe I think about that.
Yeah.
The lotus birth.
Yeah.
I was referring more to the physiology of our mouth and how do we learn to place the tongue in the right position and breathe through our nose.
Well, we're born that way. It's supposed to be that way. So that is our basic status. It's our we're born to breathe through our nose with our mouths closed. Infants until, it's difficult to say, but I would say at least the newborn phase, or at least until about 8 weeks, will not choose to breathe through their mouth. Unless they can, if their nose is completely blocked. They've done studies to see, so they can breathe through the mouth, but it's not their preferred method. So there will not be any habitual mouth breathing in infants, in newborns, sorry.
Okay.
But there will be open mouth posture. So they can have their mouth open and their tongue out. So the sleeping tongue posture hold is my favorite exercise in babies. It's when they have their mouth open, is just to put a little bit of pressure here to push the tongue up, not on the chin, behind the chin, because this is the bony part of the chin. Behind it is your tongue. If you put your thumb there and you swallow, then you feel your tongue moving. Mm-hmm. So if you put very slight pressure and you close the baby's mouth like that, then you can open the mouth and see is the tongue up to the palate. If you look it up on YouTube, it's called sleeping tongue posture hold.
Okay.
Michelle Price Emanuel talks about that a lot. The first video you will find on YouTube is from her. And then you check and you see, is the tongue up? Is the tongue up? Okay, cool, great. And you close the mouth and then things are good. So babies aren't born as mouth breathers, but they do have open mouth posture. And I believe that if you don't correct that open mouth posture, it could turn into habitual mouth breathing. So that means not mouth breathing because they have to, but mouth breathing because it became a habit. Let's call it.
Okay. Yeah. There is a big but that breastfeeding encourages good breathing technique.
Definitely, but so does bottle feeding. You cannot drink from a bottle and breathe through your mouth as much as you cannot drink from the breast and breathe through your mouth. Then you would have to pause and breathe. But there's a lot of other things that breastfeeding stimulates that a bottle does not. And I would say to get milk out of a breast, everything needs to work perfectly, while oftentimes if things go wrong, then they just give the bottle, and if it's too difficult, they use a bottle with a hole that's as big as possible so that the milk just flows out and all the baby has to do is swallow.
But would you say this is okay?
No, because then I would not, even if you would choose not to breastfeed, if there were difficulties breastfeeding, I would look into that. I would look into why. And even if you choose to give the bottle, I would still want to look into, are all these muscles functioning the way they should? Are they swallowing the way they should? When they're at the bottle, are they swallowing the way they should? Don't misunderstand me. I am the biggest advocate for breastfeeding. I would encourage the whole world to try, and I would, because often people say then, yes, but it's not possible for everyone. And that is a cultural problem, and the fault of our medical world, because women are not supported in the right way to breastfeed.
Okay, in what way do you mean? I feel like countries may be different, but in the end, they end up being the same.
There are differences, but let's say that I don't think there's a lot of countries that have it, that do it in a perfect way. That means that people should be talking about breastfeeding much more often before pregnancy. It's not something that you just do, but if things go wrong, you should know not to panic.
Yes.
You should know that, okay, there's people I can contact who can help me, and I've already looked for these people before. Because if you start looking for a person to help you when you are 1 week postpartum and you are tired and your nipples are bleeding and your emotions and your hormones are all over the place, and then you have to start looking for people to help you, things are going to go wrong. we get mothers on the phone on a weekly basis who are crying on the phone because nobody's helping them and they don't know where to go. And our medical system should help people prepare for this upfront.
Yes, I completely agree. In fact, I had a patient just a few weeks ago, and she was struggling to breastfeed. She pushed through for a month, but she went to the hospital with mastitis. We called it mastitis. And the nurse at the hospital, she was crying. She said, I can't breastfeed. It's okay. I can't breastfeed my child. And the nurse was saying, no, you have to do it for him.
Yeah.
And I thought,
I
wow.
understand. Perfect. Because a lot of people tend to say, yeah, breastfeeding, it's the most natural thing in the world. And you're a woman and women have done this for thousands of years. So you will do it and you will be fine. And if it doesn't go fine, then that woman feels as if she's failed. Like, I'm not a woman because I'm not a good woman because I'm failing to do what is most natural, and that is feeding my child. So it's about giving correct information and saying, okay, we don't live in a society the way we did 2000 years ago. We live in a different society. You might need help. And if you need help, these are the people that can help you.
Yes, I completely agree. I think we're going a bit off track.
Yeah.
We're becoming maternity advisors. But
it does start there. And because people often ask me, why are things so wrong in the mouth? Why do people have cavities? Why do they have crooked teeth? Why do they have so many health issues in general? And it starts there.
Right. So it starts with the breastfeeding, or it starts with the function that you develop from breastfeeding, or from how you eat from birth?
As we discussed before we started this, it starts before pregnancy, but I promised we were not going to get into that. We might do another.
We can talk about pregnancy.
I will try to make it short, but
just because, sorry to interrupt you, but pregnancy does have a very strong impact on your child, on your mouth, and all through pregnancy, how you deal with that, it's going to affect your mouth.
The easiest
and your general health
way, the easiest way to see this is that what I resent general medicine most for is the fear mongering during pregnancy. Everything is about fear. If you don't do this, your child will die. If you don't do this, your child will get this problem. If you don't do this, if you do this, your child will die. Everything is about fear. And fear creates tension. Fear creates tension in your fascia, in your connective tissue. And if your tissue is tense, the baby's tissue is tense. We see babies that are a few days old, and I send them to an osteopath, and an osteopath just tells me, this baby is tension. It does not have tension. It is just one big ball of tension.
Wow.
How can a baby be born that tight? And I'm very sorry to say this, but this rarely happens when the mother and father or whoever the parents are very laid back. And I don't blame the parents at all. This is something where I definitely point a finger at the medical system. It starts with that fear during pregnancy. It starts with what you eat before pregnancy. Because as I said, if you're sick for your whole pregnancy and you cannot eat anything properly, what are you going to feed? What nutrients are you going to use to make your baby? So if you're already taking care of your body and your mind in the years before your pregnancy, that's going to make a big difference. So at any point in your life, you can make a change. And even if you already have children who are older, changing your lifestyle will have an impact on your children.
Of course.
It's never too soon and it's never too late.
And by lifestyle, you don't just mean your diet, because diet does affect your inflammation all around, but also how you go about life.
Yes.
So if you've been a stressful person your whole life, you're most likely going to have...
I believe that lifestyle in that way is more important than nutrition.
Yes.
I know people who are obsessed with their diet, who are micromanaging their diet, and they're very unhappy because of it, and they're very unhealthy because of it. And sometimes we see people who have a crappy diet and who basically are functioning pretty well, because I think obsessing about something that is good is not good. So it is the lifestyle in the way of stress. And as I said, we are there's like two extremes. There's the people, the workaholics, and who still believe that we have to climb the corporate ladder, and I have to be a full-time working person and a full-time mom, and who get burnt out because they use both. And then there's the people who are like, yes, I have to take care of myself and only think about myself, and everything has to be easy, and there cannot be any stress. It's impossible. There is no way to live without having any stress, but there is also a way to live that is just way too stressful. So I think we need to be somewhere in the middle where we're like, okay, life has difficult things that come to us and we are strong enough to handle them. So that's the stress part of it, and I think that has a big impact on the baby. That has a big impact on having babies. If there's too much pressure on we must have a baby.
Well, I think that this way of medicine has been like inherited, generational.
Yeah. It's a cultural thing.
My mission with this podcast is to give the tools so everyone is consciously deciding what type of life they want to live. Exactly. If they want to smoke, go for it. If they want to quit smoking but they don't know how to, I'm here to help them because maybe these types of people, they need a guidance, someone to talk to about the anxiety they are feeling that is making them smoke.
And no one is expecting them to be perfect. And as you said, if you want to smoke, smoke, but own it.
Yes.
Don't say, I have to smoke, because you don't have to. You can choose at any point to stop. And people will hate me for saying this, but you can change your life at any point. And if you don't want to, that's fine. But just own it.
I know, yes, definitely. Is that what you as a functional dentist does for your patients? Or
I do. I tell my patients I try to do as little as possible. So I will try to see where their issues come from. We look at the mouse, we see all these things. It's basically a mirror for the whole body. And then I try to guide them and tell them, okay, go to this person, go to this person, go to this person, and let's see where we can get your mouth, but your whole body health as well in this way, so that you don't need me and you don't need a doctor and you don't need anyone else.
Wow.
It doesn't always work, but it's the goal.
Okay, that's why you're there.
It's the goal. It's the goal. Yeah.
Which is amazing because it's unbelievable how much we can prevent by treating early, or not even. It's not the word's not treating. The word is observing.
Observing.
You observe it early on,
and guide. You observe and you guide. That would be a very good way of putting it.
So I feel like you have a very big impact on pregnancy, maternity, and the babies and early age. How do you guide these three types of patients? Babies, especially mothers. I think moms, especially this podcast is catered for moms, so it's very important for them to understand how a functional dentist can help you throughout your pregnancy.
I in the best way would be before. Because, like I said, if you're not breathing correctly, oxygen is not going to your tissues, but not going properly to your baby as well. So in theory, we would want them to be breathing properly before
getting pregnant.
Before getting pregnant, because your breathing is going to get worse during pregnancy. You do two flights of stairs and you will be completely out of breath and you will be like, who is this person? So you need to be like in your top game before you get pregnant. That would be ideal. I think during pregnancy, there's not that much that the functional dentist could do, but to what I do with my pregnant patients is I do tell them, don't let them get into your mind. Don't let them make you crazy about all these fears. And but that's not my role as a dentist. That is just my role as a person or as a mom talking to another mom. And then, of course, there's the talk about having good oral hygiene and stuff. But honestly, I don't believe that's the most important part. And I'm a very bad dentist in that way.
That's okay. That's okay. Everyone's got their opinion.
You should go to the dentist 2 times during your pregnancy to have a good cleaning. And I would rather have them relax during their pregnancy. Tell them,
Yes.
relax, eat good food, take care of yourself. That would be my main advice.
In that case, maybe you as a dentist are not acting on the mouth, but you are being their guide through the pregnancy. So they do still come and see
and
you.
I would advise them, if they're patients of mine who've been coming for a long time, what we said before, I would advise them to get a really good midwife. I would get them to ask them if they want to breastfeed, to get a good lactation consultant already before, because they're all very busy. And if you're going to call a lactation consultant and say, well, I have a 2-week-old baby and we have issues breastfeeding, and I know you don't know me, but I want to see you today, that's not going to work. So I would ask them to get a good team around them, to get a good osteopath or chiropractor that they know that they could see during their pregnancy. I think one of the most important things to do during your pregnancy is to see a good physical therapist, chiropractor, osteopath during your pregnancy. I took a course in the United States with, I don't remember her name, but she was a gynecologist, and she was an osteopath as well.
Wow.
And her hospital has the lowest C-section rate in the entire United States, because she treats all her pregnant moms. And why? Because what do osteopaths do? They release tension. If your hips are blocked, how can you give birth? If your entire body is blocked, how can you relax during labor or during pregnancy? So those would be the things that I would recommend, like get a good team around you.
I'm getting the vibe of you're going to the root cause. Your practice revolves around going to the root.
Always ask, why.
Yes.
There's always a why, and as long as we don't treat why, we are just, I don't know if we say this, we bring water to the ocean. we're not helping anything.
That is very aligned with how I try to observe the dentistry and my clinical practice, but I feel like you've got very different tools than not different, sorry, it's something I aspire to, having this team of collaborations with a chiropractor, a myofunctional therapist. I think that is very inspiring and very necessary as well.
But we started with the idea that everyone like us has, like, I want to have this clinic where I have everyone in the same team. And I can honestly say it's not necessary. You just need a good network around you.
I feel like we've touched base on a lot of topics, and we've not really mentioned about you. Who are you, and what's your practice like, and what's your journey like? Because I really find you an inspiration.
Oh, thank you. That's so nice. I feel like I told you before, I'm nowhere near where I would want to be, and that is partly because of my chaotic personality. But my journey, my mother is a dentist, and she's an amazing dentist. To me, she's the best dentist in the world, and she inspired me to become a dentist. And she's the reason why, up until I started studying dentistry, I had no idea why patients were afraid of dentists. And then I went to university, and I said, oh, now I understand. I once fainted watching a dental procedure, because I've never saw anyone give an anesthetic that way. They just push in the needle, push in the whole thing at once. And
I've seen that too.
Yeah, and my mother was always like super gentle, and patients were like, "Oh, when are you going to do the anesthetic?" And she'd be like, "Oh, I just did," and "Oh, I didn't know." So she's been a real inspiration, and she's always been very concerned about the link between our mouth and our general health. And she knows a lot of dentists worldwide, and she spiked the interest in me. And because of my own breathing issues and health issues, I started investigating more, and then I met the right people at the right time, who guided me towards myofunctional therapy at first, and that's where everything started. With the first myofunctional therapy course.
You are a myofunctional therapist.
I am not. I do not want to call myself a myofunctional therapist at all. I'm just a general dentist, but I am obsessed by myofunctional disorders and myofunctional therapy.
How crazy!
So I took a few courses on myofunctional therapy and disorders and what they do, and I cried my eyes out after that, because I felt like I'd been disappointing my patients, and I've been missing so much in my patients that I should have been taught at university. And then I
understand.
decided to turn my entire practice around in 2 days. I decided this is not who I am anymore. I was, in the best case, not creating any problems, but in the worst case, maybe creating problems that weren't there before. So that didn't feel right. And the way of looking at it from the functional point of view actually made me realize how powerful we are as dentists in our ability to help people, and to notice these things from a very young age, but also at an older age. Some patients come in and I look at them and start talking about these things I see, and then they're like, oh yeah, but my husband says that I snore, and then I start talking about it and everything starts to make sense to them. So like
and
I
you
said,
feel like you're a magician. Sorry, I interrupt
yeah,
you. But,
I do
and
not,
they're like, wow,
yeah,
how do
yeah,
you know?
yeah,
And I'm like,
exactly,
I am a wizard.
yeah, exactly. I have a crystal ball and I can see these things. No, I can tell from a child's mouth. I can tell that they have difficulty regulating their emotions. So I say this to parents, and they're like, "How do you know?" One, because every child has difficulty regulating their emotions. So that's a nasty trick. Yes, but you can see so much from the mouth, and we can do so many things for patients in such a non-invasive way, and that is probably my take as a dentist. I don't like very complicated and very complex procedures. I am not the dentist who is going to shift your jaw and all these things. I try to go to the basics of it. And if we don't cover the basics, we're not going to go any further than that.
That's why I really appreciate doing hosting professionals that can add their little pinch of salt to the movement. Because I feel like eventually more and more people are thinking and really raising awareness on what they are, because we've like completely been dissociated of ourselves. We need to sort of come back to us.
Exactly. Like I said, we've given our health and given it to the system, and for some people because they want to, but other people just because they don't know that there's any other way.
Our health and everything, because our finances as well. When is the first visit of your baby, your newborn babies? Do you see them?
I don't see them personally, but the lactation consultants in our practice see them.
That's where I wanted to get. I see your team is built around prevention. So you have a chiropractor, a lactation consultant.
Yeah, we have 3 lactation consultants.
3, wow.
Yeah, yes, but they don't work like in your practice. They don't work every day, but we work with a lot of chiropractors, osteopaths, midwives, lactation consultants from outside the practice.
Okay.
So because we used to working together a lot, we do courses with them. They teach us, we teach them. So we know a lot of people around us. So they often refer to us. I wouldn't call it prevention, because in that case, they're often sent to us when there's already a problem.
Okay.
So to me, that's by the lactation consultant, for example. So if the lactation consultant or an osteopath or a doctor or a midwife suspects that breastfeeding isn't working because there might be a tongue tie, then they refer to us. And then my job and our lactation consultant's job is to first check, is this a real tongue tie problem, or are there other layers to it that should be treated first?
What could be affecting a potential tongue tie? So what are these layers that you mean?
Tongue function. You could have all the issues of a tongue tie without having a tongue tie.
Right.
If the tongue tie isn't the problem, it's the function. Imagine, it doesn't happen, but imagine if the tongue is so tight to the floor of the mouth that it cannot move at all. It's so tight. But everything functions perfectly, without any compensation, without any issue whatsoever, then it's not a tongue tie to me. It doesn't happen, of course. I'm in a very extreme.
You're making it.
But I've seen tongue frenula that look tight, but for the life of me, I don't see anything wrong. Their face is growing well, they're breathing well, their swallowing function is well. I send them to an osteopath to check if there's a lot of tension. There is not. I've seen those. They look tight, but there is no issue that can be found even with the broadest. And maybe I might, and those patients, I tell them, Let's keep it in the back of our minds.
Uh-huh.
But I want to check the function of the tongue. Is the tongue moving correctly? Are they swallowing correctly? Is there a lot of tension in the mouth? Those are the things I want to check first. So that would be, in some cases, that would mean we would give them some exercises to do to stimulate the tongue. I see babies where the tongue just doesn't move. And then they're like, yeah, they can't breastfeed. Well, of course they can't breastfeed. They can't drink from the bottle even. It would require the tongue to move. And there is no use in cutting a tongue tie in a tongue that doesn't move, because it's not going to move after the tongue tie release. And I still get it in a lot of discussions about this. There is no movement that is impossible because of a tongue tie.
All right.
It can be difficult, and it can be difficult to become an automatic function. But even with the shortest of tongue ties, you could still raise the tip of your tongue like this. And I tell patients, if you can do this, then you can do this. But if you cannot do this, I will cut the tongue tie, and the tongue will not be able to do this because the brain hasn't made the connection with the muscles, and the muscles don't know how to do this movement. So I never want to cut a tongue tie if the tongue can do all its basic movements.
Right, I understand.
So I would
and that is a
stimulate-
very good approach.
Yeah. In a baby, that would mean if a baby can't move its tongue to the left and the right, you could just stimulate by just moving your finger around and brushing the tongue on the sides. And little by little, you will see that the tongue will start to move. If it doesn't, well, go to an osteopath and see if there's any tensions in the skull that make for that block. It's an easy way to say it. It's not exactly that way, but that would block the nerve that goes to the tongue. Because if the nerve isn't functioning, well, then you can do exercises for the rest of your life or cut the tongue tie 1,000,000 times, the tongue will still not move. So those are the things we check first.
Wow, that is so interesting.
And again, this sounds perfect, but in reality, you have a mother in front of you who is crying her eyes out because her nipples are bleeding. And then you're like, yeah, but we're going to check for a few days and give you some exercises and send you to the osteopath. And it's not easy because in some cases you have to decide quickly.
Yes.
If this is a mother who absolutely wants to breastfeed, or if this is a child who cannot feed in any way at all, because that happens too, then you do not have the luxury of doing all the steps in the perfect way. And then you have to decide, okay, in this case, what is the best thing we can do with the knowledge that we have today? So that could mean, okay, I'm going to give you exercises for 1 day, I'm going to send you to the osteopath tomorrow, and we're going to release the tongue tie in 2 days. But I don't think I've ever, yes, I did twice, and they were colleagues of mine, the children of colleagues of mine. But one was a chiropractor, so she already treated her baby before, but we treated her son when he was 30 hours old.
Wow.
Yes. But she already started doing, even then, she already started doing exercises.
30 hours
30
old.
hours. She already
baby.
treated him. I think she treated him, or she asked a colleague to treat her son already before. And another one was another colleague, and that was during the COVID period. So there was no osteopath to be reached. But what we did then is we said on day 4, we'll cut the tongue tie now, you'll do the exercises. Once life is normal again, you'll go to an osteopath, and we will reevaluate in a few months and see if we need to cut it again. And we did cut it again, but then in the correct order of things.
Yes, of course.
So there is no perfect way and there is no perfect situation, but with experience from all the people in the world who've done this together, we can learn so much from each other, and then try to find a way to help every patient in every situation the best way possible.
Wow, I think we've spoken about a lot of things.
Mm-hmm.
Is there, maybe we could summarize, or maybe is there anything else that you want to add to the conversation? Something on prevention, especially from a very young age. You didn't actually say what is the first day to bring the child
to the dentist?
Or to a practice that is very holistic, because
I would say as soon as mom wants to leave the house with the baby.
Very good.
That would be, yeah.
I love how science, everyone has their own opinion.
Yeah.
Everyone's right or wrong. I don't know. It's whether the person listens to it and it resonates.
And if there's urgent issues, as soon as possible. If there's no urgent issues, I would still advise to see people just to check if everything is okay, because real prevention is when there's nothing wrong yet. As soon as something is wrong, even if I like to call it prevention, it's not prevention. Screening for breast cancer is not prevention. As soon as you're doing something, it's not prevention. So true prevention would be seeing a baby that is 4 days old and saying, okay, baby is doing perfectly fine, but I find some tension in the neck. So we're going to gently release that tension. And then the lactation consultant looks at the baby and says, okay, breastfeeding is going great, but I can see some milk spilling from the corner of his mouth. Nothing to worry about, but I'm just going to give you some exercises to do. I'm going to show you how to change the positioning of your baby and make sure you won't get any issues down the line. That is real prevention. That is making sure the bad things don't happen.
Yeah.
But people have a difficulty doing things when nothing is wrong.
I know, because they don't see the problem.
And because it gives some people the idea that we want to make money out of them.
Mm-hmm. Yeah, I understand.
And other medical professionals say this. You don't have to do this. They just send you to the osteopath to make money out of you. But well, yeah, I can only speak for myself, but that is definitely not. If I would be in it for the money, I would stay in aesthetic dentistry. That is where the money is. Yes, because we're so lucky. If you do aesthetic dentistry, everyone is grinding their teeth and everyone's a bruxist, so you can do their teeth again every 2 years. It's a steady income. Yeah,
and you just say you have to manage your stress.
Yes,
and don't grind them.
Yeah, just stop grinding your teeth. And brush your teeth better, because and come to the dentist every year, because that is going to solve all your problems. Yes. Yeah.
I completely agree with you. You're funny. All right, how do we wrap this up? Do you want to give some? I feel like you're very into lifestyle, and lifestyle does have an effect on mouth and general health. So maybe give us a few tips on lifestyle, the best lifestyle prevention, lifestyle habits that could prevent.
The easiest one, in theory, would be always breathe through your nose. That will make your life much better.
Would you say rest your tongue on the roof of your mouth?
Definitely.
Because we haven't spoken about that. But
rest your tongue on the roof of your mouth, keep your mouth closed and breathe through your nose, and chew your food like your life depends on it. Really. And chew foods that are worth chewing. Chew different kinds of food, chew hard foods, chew chewy foods, chew a lot, and chew consciously. I don't know, but there's this thing where they say that you have to chew every piece of food for 20 times. It's disgusting. It's impossible to keep doing that. So what I tell my patients is, when you start eating, sit down for a second, remind yourself, for the first 2 bites, I'm going to chew consciously. I'm going to feel, what am I doing? And oftentimes what happens is, after you chew 1 or 2 times, you'll want to swallow, and you'll be like, no, let's just chew some more and feel what we're doing. Do that for 2 bites, and then just enjoy your food. And you will teach your brain to be more conscious about chewing.
I find myself doing that now, consciously chewing and swallowing. And I see that when I'm conscious is when I'm taking a deep breath. Not a deep breath, sorry, when I'm inhaling. Yeah. Sometimes you forget. Yeah. You just shove the food in your mouth.
Oh, yeah.
And you're good to
we would breathe the food in if we could. We would definitely, I would. Sometimes I look at my plate and I see it's empty and I don't know where the food went. So I am definitely still a work in progress. But I think those would be I think I could talk for 5 days about how important chewing is. So that would be my main advice: chew well and chew on both sides, even if you're missing teeth, because that's the big excuse. Yes, but I'm missing a tooth there. I have a cat who has no teeth, and she's the one of the 3 cats who actually chews her food. So if she can do it, you can do it too.
Wow, wise words of a functional dentist.
Thank you.
Very good. Thank you so much.
You're very welcome. Thank you for having me here.
It's a pleasure. How good. Hi, Charlotte. This
Tomar las riendas.
Un equilibrio entre la mujer y el hombre.